there is a very strong element of empowerment. Empowerment for what? Empowerment to fight gender-based violence. Empowerment to enable women to live in society and to communities where they care for each another.
We have come to this community to see firsthand how the Central Emergency Response Fund project called SURF under the Office of the Resident Coordinator is performing on the ground. And through our implementing partner Musasa and under the protection cluster, GBV subcluster that UNFPA leads within the United Nations Coordination Mechanism for Humanitarian Response, we have come to see firsthand how this project has been supporting this community.
Musasa has been implementing the Central Emergency Response Fund program, which was supported by UNFPA. The program was focusing on enhancing access to multi-sectoral GBV services, but also with a very strong focus on GBV prevention and GBV risk mitigation. Musasa was also focusing on GBV risk mitigation, which was through safe spaces. The establishment of safe spaces was creating an opportunity for women to talk about issues that directly affect them. It was a first entry to accessing GBV information and services, but also complemented strongly by a livelihoods and economic empowerment project. So women were doing different projects, varying from poultry, goat rearing, peanut butter making, sewing, various livelihood projects just to increase their economic independence and economic empowerment, because one of the key drivers to gender-based violence is economic insecurity.
Right, umsebenzi wethu ukuba ngu-SBCC yikuba ngihamba ngifundisa izakhamizi ngendaba yokuthi sibone ukuthi khona kulento okuthiwa yi-gender based violence. I-violence leyi ikhozwa yini bekule El Nino. So nxa kule El Nino, it's obvious kuyabe kule ndlala, kuyabe komile. Nxa kungawoma kule ndlala, it's obvious ekhaya kuba lani le GBV. So sasihamba sifundisa abantu, our main issue ukuthi sizo-addressa indaba yendlala through ukufundisa ukuthi omama kumelanga bahlalele izandla, kumele basebenze. Bangasebenza i-GBV zaba njani? Izaba ilutshwana ngale ekhaya ngoba wonke umuntu uvuka ebhizi esemsebenzini. So isikhathi lesiyana sokuthi kukumezana siyabe singekho. Okunye njalo ukuthi sananzelela ukuthi khona khona lapha ku-ward level kuba lama abuse akhona kodwa engananzeleleki ngendaba yokuthi abantu abangomama bebengela chance yokureport. But kuthe sekubuye imisasa sisifundisile sesihambile ku-workshop, mina ke sengikhethiwe ngase ngihamba sengisiya abafundisa ukuthi khona kule abuse ekhona, ingaba khona emotional, physical, ingaba khona even i-rape. I-rape yayisiba khona lapha esigabeni kodwa yayingaripotwa. Why? Vele isintu sethu esisutini asivumi. Uyathula kulabantu okuthiwa ngumntwala, okhazeni, umalume, bangarepa eyisihlobo. Sokusiba nzima ukuthi uzamripota njani ngoba nguye i-breadwinner phela. Nxa siyamripota uzabotshwa, ekhaya sizabulawa yindlala. So from day teaching yethu baqala ukuba open ukuthi bahambe beyiripota ama-case uma ekhona.
Mina ngumsaneliso Moyo, ngihlala eMahongola. Ngileminyaka engu-37. Thina lapha sesishayelana siliqembu. Besishaya imali kuthengwa ingubo namabhodo. Khathesi besithi siyaqala okunye kuchaya imali futhi sithenge something okunye esikucabanga. Ukuba phakathi kweqembu leli lingisizile ngingumama bengihleli nami ngingazi lutho, ngabizwa ngomunye, ngajoyiniswa ngusisi wami. Bangisiza, mina bengingela lutho. Ngilabantu abami nje. Ngatshonelwa indoda. Bengingazi ukuthi lami ngikhona ukuzisiza. Kade singasizakala. Kuyangisiza ukuthi ngithole le mali ngibhadalele abantu abami esikolweni.
Number one for us is breaking new ground in a lot of districts, 8 districts across the country, bringing innovative interventions that we believe have made a difference in the lives of women and girls. If you look at the package under the SURF program, it's really holistic, very different, very unique. Looking at the other programs that we have implemented, we are looking at GBV risk mitigation, at the same time looking at response, but also with an added layer of how we can support women in their livelihoods, how we can support them to economically empower themselves. But also for us, when we look at the GBV risk mitigation, the safe spaces are a model that we see as very key, but also very sustainable, which can go even beyond the lifespan of this program.
Inkinga engilayo mntana bengihlala naye kade siye 4 years sihlala sonke. Then inkinga eyokungishaya iqala sibek. Uyanatha, uyadakwa. So inkinga vele mostly bisenze ngani ukuthiwa sixabana kakhulu okwakathesi. Yokuthi ubesebenza engabuyi le mali ekhaya ubengishaye wandlimaza. Yikho lapho engigcine sengidinga usizo kwakusasa. Then ngafona kusebusuku babe abazongithatha eStanmore bangihambisa esibhedlela. From esibhedlela bangihambisa emapholiseni ukuya report case. Angikho kuye bangincedisa nge-transport ngakumama esportini. Abantu nabangomama singafi isithuli. Singathola usizo olukhulu kakhulu kwabomsasa indlela sizakala.
We've been implementing this Central Emergency Response Fund intervention from January to June of this year. The intervention is 6 months because it was a rapid response. We have received funding from SURF to implement anticipatory actions around gender-based violence within the country. We also had community-level interventions that aimed at raising awareness around gender-based violence, as well as making sure that communities are aware of their rights in terms of accessing emergency response services free of charge without any strings attached. Safe spaces are essentially places where women and girls meet, talk about the issues that affect them that they want to talk about, but also serve as a GBV risk mitigation measure. We also had livelihood interventions that were implemented at the safe spaces. So we do feel that the project has been impactful. We have managed to reach more than 30,000 people with key messages on GBV, and we feel this was really an important step in us being able to support the communities to respond to gender-based violence.
Ndonzi Sibusiso Phiri ndikugara muno mu Fountain tiri mama veMasiye Phambili project tiri under SAFE tiri kuita mining panapa tutazokuchera gold pass sawana mama chida kubatsira mhuri dzedu ende zvinhu izvi takadzidziswa neSAFE neproject yetu yeMusasa ndiyakauya nezvinhu zvese panapa kuzotidzidzisa kuti tingaita sei tiri vana mama kuti tiite something kuti tigone kuzvibatsira nemhuri dzedu ende kuti stop GBV panapa. Chero program yapera tiri kufambira mberi chingochera chiita mari dzedu dzishoma titengesa zvinhu zvedu tiendera mberi.
To me, these are the positive illustrations of what we are seeing here. And we will continue to see whatever we can to continue helping them so that they can continue empowering themselves.